There are new and emerging health concerns and expectations in terms of how these health concerns are treated. Pharmacology includes the study of existing drugs, including their sources, chemistry, production, and uses in treating diseases and side effects. It is truly a field of study that helps create new knowledge about new drugs, new therapies, new sources, and new therapeutic targets. It's so important to recognize that cannabis is a medicine that can heal you. And our guests today are all advocates of a natural plant-based therapy, cannabis, that everyone deserves to consider. So I want you to meet our special guests today, who are all pharmacologists. We're going to start on the East Coast with Dr. Craig Levand, who is a native New Yorker with a doctorate in pharmacology and a degree in botany, where he combines modern medicine and plant chemistry. 20 years of clinical experience treating patients in multiple settings and with very diverse diseases has given him a unique outlook on health. He has been studying the benefits of cannabidiol, we'll tell you more about that soon, which is also CBD, on the human body, from anecdotal evidence to clinical research. Brian Center, RPH, is coming from Connecticut, and he is a pharmacist and former dispensary manager. He is currently the owner of Consult CT, where he counsels patients on the effects and side effects of medical marijuana, as well as the possible interactions with other medications. He also consults for businesses in the cannabis industry. And coming from New Mexico is Shanice Doyle. She's a third-year pharmacy student at the University of New Mexico. Her interest for pharmacy was ignited with her passion to help patients with their personal medication and treatment. She is a student leader in various pharmacy organizations and works as an intern at a local hospital. Welcome, Craig, Brian, and Shanice.
Thank you.
Thank you.
So happy you're here today. So why don't you just get off and tell everybody, what is the role of the pharmacologist when counseling patients? Craig, why don't you start us off?
Answering all of their basic questions, letting them know to consider cannabis or cannabinoid therapy as a treatment like they would any other medication. Basically, going through the consumption and then effects on the body, how you should feel, and how you would expect to feel from that therapy, and then document that and go about your therapy as you would with other medications, not like a recreational substance that cannabis can also be. So that's very important. Emerging therapies in CBD, cannabidiol, like you were saying, have helped a lot of people. There are studies out there now, and they're ongoing. So it's an emerging therapy, which is very exciting for all of us.
Well, marijuana plants have multiple chemicals known as cannabinoids. Two main ones are THC and CBD. So I know we have a lot of language that probably many of our viewers and listeners have no idea what we're talking about. So, Brian, why don't you explain a little bit about what cannabinoids are?
That's a great way to start, actually, with the word cannabinoid. So cannabinoids actually encompass all of the chemicals in the plant that have an actual chemical activity in the body. Right now, the majority of the accepted number is about 110 different cannabinoids. I've heard numbers as high as 144 different cannabinoids. There's really only about 9 or 10 that you see in any abundance that are really effective in therapy, but that's where things can get very confusing because your THC or your delta-9 tetrahydrocannabinol is those psychoactive component that everybody knows about. But when you look at a raw flower, that actually presents as THCA, which is your acid. So it doesn't convert, and as THCA, it's non-psychoactive as well. Doesn't convert to the psychoactive chemical THC until it's decarboxylated or heated. But those are just two of the cannabinoids. Cannabidiol, or CBD, which is what it's commonly referred to, is your second most abundant cannabinoid that you can find in the plant. But one of the biggest misconceptions, or where the language gets confusing for people, is when you're talking about cannabinoids as a whole or cannabidiol as an individual chemical as well. So it's very difficult for new patients to be clear as to whether they're getting a certain amount of milligrams of cannabinoids or a certain amount of milligrams of cannabidiol, which are two very different things. 100 milligrams of 10 different cannabinoids could be 10 milligrams of each cannabinoid, as opposed to 100 milligrams of cannabidiol, which is the active ingredient CBD, is a much more effective product.
Shanice, so why don't you tell us a little bit more about the differences, the benefits, and all three of you can chime in on this one, because this is really where we get into really understanding more about the plant, the differences, the benefits, the effects, the side effects of THC and CBD, and even when they're used together.
So there are benefits, obviously, to both THC and CBD. Obviously, we know that there are the psychoactive properties that come with the THC, which is what some people want, what some people don't want. The big benefits that come from them, obviously, that we're seeing in studies, they're going to be as antiemetics. So that means like anti-nausea medication, especially for cancer patients and things like that. There are already medications currently on the market, like dronabinol, that are compounds of THC that are just synthesized, so they're the only THC in them. Now, a lot of where the studies that I'm seeing are showing are that they're thinking that the best clinical benefit comes from the entire plant. So what Craig was hitting on was saying that you have to have the CBD, you have to have the THC, you have to have the other terpenes, the flavonoids, like everything is what makes that best effect for the patient. So that's where you're going to get the best clinical benefit coming from. That's something that I have,
I mean, the phytocannabinoids you're getting out of the cannabis plant all present their own unique traits and responses in the body. And there are hundreds of them, as Brian was referring to, 140 plus, as he might have mentioned. But those cannabinoids also working with those terpenes, and the synergistic effect that they're really having as a whole plant, as the entourage effect, as it's also as it's called by many, really is a unique thing. And just isolating the THC or the CBD component is great, and it can really have benefits on certain illnesses. But utilizing the whole plant really can have tremendous effects on just the overall health and well-being. And as Brian was mentioned earlier, before you decarboxylate or take off the acid from that THC molecule, the anti-inflammatory effects of that THCA and the antioxidant effects are tremendous. I mean, and the omega-3s that you can get out of eating this raw plant that won't get you high. It's non-psychoactive is tremendous. So there's a lot of things and much research and a lot of health benefits can be gained from just consuming that whole plant. I mean, we've been neglected for the last 100 plus years of research in this country, at least. So, I mean, there's a lot that we can do, and it's a really great time.
So why don't we talk a little bit about formulations and delivery methods? Because we know that it can be taken in a variety of ways, and it is, both really for a lot of medical conditions. So, Brian?
That's a great follow-up, actually, to what Craig was just speaking about, because the formulations are going to be determined a lot of different ways. So, Yeah, you can, depending on your delivery method, the formulation can be, you can have THC only, you can have CBD only, but really the entourage effect and that whole plant is about having both CBD and THC together. And depending on what type of relief you're looking for or when you're looking for it will depend on what that ratio might be. And then you get right into your delivery methods, because depending on what delivery method a patient uses will depend on how fast the medication starts to work and how long it's going to work as well. So if they're looking for something that's more breakthrough pain or anxiety, panic attack, you're looking for something that's more inhaled, a vape or smoking. That's going to kick in 5 to 10 minutes, going to last you about 2 to 3 hours or so. But if you're looking for something that's more all day long, then an edible might be more your speed, but it's going to take anywhere from 30 minutes to 2 hours to kick in. It can last up to 8 hours. So you really have to be careful too, because with edibles, you slow and low. You do a little too much and you're on a very long, bumpy ride you're not prepared to be on. Whereas something like, vaping with a faster onset, you're able to control how much or how little you're able to use at any given time. So that's where it starts getting into very patient specific. What is their tolerance? What are their goals of what they're looking for? And what time of day is it as well to what formulation they're using.
And also what they feel comfortable with
Yes.
utilizing. You also have to realize a lot of these people have been using cannabis either recreationally for a long time, so they're very comfortable with smoking it and inhaling it through a vaporizer, which is a much healthier way than combusting it through just flower, just because even though it's used medicinally, it still forms carbon monoxide and formaldehyde and acetaldehyde, which can all be carcinogenic, especially people who have a weakened immune system a lot of times that are using it for the medical benefits. You really don't want to have those, even if they're minute, combustible with them. So that the oral route is also a great way, which Brian was saying, but going slow and staying low is very important. Just because, like I think I mentioned earlier, it's for a medical condition was what most of these people want to treat it for. I mean, enjoying yourself is one thing, using it recreationally, but when you're treating a condition, you want relief, and you want to have a relief of those symptoms that are going to make you be able to, have that thing you were lacking, or be able to go outside, or be able to have more movement or eat some more. So it's a very thin line between how you speak to your patients and what you want to get out of using cannabis as therapy.
What about tinctures and topicals?
Oh, tinctures are great. You have a very fast onset of action. 15 to 30 minutes. Not as strong as, let's say, the edible effect, because you are bypassing the liver. So the conversion to the 11-hydroxy THC, which is the more potent form. That's why people really have to think about when they eat it, because it gets converted in our body. It gets conjugated to a more active form of THC, and that's why you have that longer effect, and also the more intense psychosis sometimes that people can experience from an overdose. But yeah, I mean, and women down there also metabolize it a little quicker, so they should also be aware of how they're dosing. So yeah, I think a elixir, sublingual is great. I also work in a compounding pharmacy, so I love topicals. I believe it's a great way to get immediate relief to a specific area. So I think Brian has some also information to say on that.
I do. Yeah, I love topicals. There's a couple of things in this area of delivery methods that I feel very passionate about, we'll say. With topicals, what I found is local relief is really what you're getting. The transdermal patches and such, I've never been a huge fan of, unless you're looking for relief only in that area, more like a lidocaine patch, something along those lines. But topicals are spectacular because it doesn't get absorbed, so you don't get high from it either. So, I mean, unless you go get a full body massage, then you'll probably feel that. But you can feel very comfortable using it anywhere, any time of day, and it's not going to affect your cognitive ability to do your work or anything else at that point. The tinctures are spectacular because with that fast onset, it's very easy to adjust your dose as you go. One of the other silly little lines I like to tell people is you can always do more, you can't do less. But because it kicks in fast enough, it's much easier to adjust a dose in the same day as opposed to having to wait till the next day or a couple days later to actually get some relief.
Well, when you talk about dosing, okay, because you've said that a few times as you were sharing that information, okay, so there's not one size fits all. And dosing, I feel is not only related onto what your physician may tell you and or what your pharmacist dispenses to you, but also you have labeling. So you have something that's recommended on how much you should take of a particular product. And then you also have labeling, and research is limited, and this is still very foreign to a lot of people, so labeling, and actually report in the media, just a lot of reports in the media lately about, with CBD, there's no CBD in the products. And so, the buyer needs to beware, but what should we be looking for right now when it comes to labeling and also know about dosage?
Labeling, you should really be looking for the lab results. A lot of times now you'll be able to have QR codes that you can just scan with your phone and really get a recent lab report, or at least the initial lab report of the product, so you know what you're getting. That's really it's kind of buyer beware in the retail market. In the medical setting, everything's pretty much very well regulated. You're really getting what it states. You're also paying the premium to get that high quality product. But doing your due diligence and really focusing on where you're getting it from and how that product was sourced is usually the first way to do it. Or if you really have a reputable spot or a reputable form of business that you go to for your medication or your health foods to get CBD, hopefully they're sourcing it properly, but still you need to do your due diligence.
I think that relates even to what we would see in a normal pharmacy world as well. For consumers who might not know, most vitamins or anything like that over the counter isn't regulated either. So you could be paying for something and pay for a tablet that you think, is, this wonderful pill that's supposed to help with memory loss or things like that. You pay extraordinary money for it, find out it's flour in a capsule or a gel capsule, and that's not regulated that way. So doing your due diligence as a consumer and finding out, where that's made, where it's sourced, if they have lab results, doing all those things is important, just as it is in the world that we already live in with the over-the-counter supplements that we see.
It's great.
One of the important parts there is don't get it from your gas station or anything. Any bottle that doesn't have any information on it, then I would absolutely stay away. But one of the things that I found a lot of them are doing, at least the ones that are much more reputable, is they'll have a QR code on there that you can snap, and it'll bring you right to their testing information and everything too. Now, obviously, if it's a screenshot or something of that nature, then maybe not so trustworthy. But for the most part, it'll take you to a website that shows where they got their testing from, that is from the lab that did the testing. So that's the kind of stuff I would use to make my decisions as to which product I'm doing, along with what Craig said, going to your Whole Foods store, or talking to somebody that in the area, in the arena, that has an idea of what a reputable product would be.
What I'm curious about is how often are you even asked about cannabis for healthcare?
I would say as a student, I do a weekly rotation where I go and work at a hospital and have to do what's called medication reconciliation. So I go in and talk to patients that are going to get admitted and kind of just go through the current medications that they're on, how they're taking them, and then report that back so that we can mimic that in the hospital. And so the most often time that I'm seeing it personally is when I'm talking to patients in the hospital and asking them what they're on. And as soon as I get to the herbals and supplements section, I'll say, are you taking any herbs and supplements? And most of them will say no. And then I always bring up no cannabis, no CBD, no anything like that. And some of them will say, oh, well, I do take CBD oil, or, oh, well, I do a little bit of that. So patients are a little bit more reluctant to, I think, say it, especially in the hospital setting when they're sitting, not feeling good in the emergency room. But that's where I see it more often, is when they report it with their other medications. And some are reluctant and some are very open and like, yes, I have to use it every day and I do it like this and this is how I take it and I go here to give it. So you see, a wide range from me for patients just at the hospital, how they're using it and how they want to talk about it to their healthcare provider.
Ryan, Craig?
I see it on a daily basis, just in the communities that I'm working in. They come in. Most of them are consuming cannabis on their own regularly on a daily basis. So we talk about that and how it can interact with their other medications that they're on. And then they also bring up the cannabidiol, the CBD, just because it's really been in the news over the last few years already. So a lot of people are consuming it. And they're even asking about side effects with a lot of their medicine. And it's more so with lab reports and clinical studies of how CBD can react with more so even than THC, just because how CBD is metabolized with these medications. But it's something that I even bring up to them sometimes for the CBD use, because we really, in New York, we're a medical state. It's not recreational. It's only in certain dispensaries you can have THC products. So a lot of the products we're discussing are CBD based, and how they can utilize them for their actual overall health. And we actually sell a hemp oil, which is just pressed seed, hemp seed, which is they're applying on their salads. They're applying it to psoriasis, which is pretty interesting. But it's a pretty hot topic right now, especially because people realize the benefits they can get from the plant.
Well, there is something to be said about availability if it's legal and if you have a dispensary that you can go to. So, tell us a little bit about that experience for a patient to get a prescription for medical marijuana, and then whether they're going for medical or recreational. What is that customer experience? What should that look like and feel like? Because I would hope it would feel safe and responsible, and so. The three of you know that better than me.
Yeah, I mean, I believe the patients feel very safe. The patients that I would see on a regular basis, the first thing they say to me is, "Oh my God, this is nothing like what I expected." And you really try to make it seem like a very professional, much more medical type of office. You don't want to go too much into the medical because a lot of them are trying to get away from that. But, you want to present a very professional atmosphere. And, when we have patients filling out self-assessment forms, listing all of the medications they're taking, what issues they're looking for, relief of, what ailments, what symptoms, and speaking to them about what, a big one is, what is their tolerance? Because everything that we're doing is very patient specific. And, if I have a patient that has been using cannabis for 20, 30, 40, 50 years, which we see, then I'm going to have a very different conversation than somebody who walks in and they have, if you have an 80-year-old lady who walks in with her daughter and her granddaughter, that, her first two things are, I don't want to get high and I don't want to smoke. Well, I'm going to have a very different conversation with her. And I think you really have to be able to walk in both worlds and be able to communicate with each of those people. And that's one of the hardest things, because, we're there for medical reasons, but there's a lot of people that know more about this than we do. There's a lot of people that have been studying this longer than we have and have been part of this world longer. So, you have very different conversations with them than you do a brand new patient or somebody that used it in college and they know what they're getting themselves into, but still don't have a tolerance you just have to be very careful, but tailor it to what they're looking for. I mean, make it easy for them, I think is the best way to get them involved from the beginning. Make sure they're comfortable, low dosages, and explain that it's a process and it's going to take a little time.
Yeah, it's patient specific, which is also very good, because the patient can actually modulate how much and how often they're taking it. And they can get, that nice sweet spot where they're not either too high or they're out of pain, but not out of the social element that they want to be associated with. So it's a wonderful product, but you want to keep the patient involved, and they need to communicate with you, like Brian was saying, and you want to see what they want and what the resolve they're looking for is, because that's the most important part. And most of the time, they're coming to you out of last resort. A lot of these people, hopefully it's not cancer, maybe it's IBS, where they haven't been able to keep something down for years, or they run to the bathroom all the time. But a lot of times it is a last resort therapy, because people are so stigmatized by utilizing cannabis as medicine that they wish they would have came to it a little earlier. So it should be a welcoming experience for these people, and letting them know this is there to help them, and they can get as much or as little benefit from it as you can give them.
So we hear a lot that cannabis is a gateway drug. We hear a lot about the opioid crisis. So I'm really interested in hearing how you think we can best combat that, because we hear about big pharma all the time, and we hear about the prescriptions for painkillers all the time. So what do you guys think when it comes to cannabis and the opioid crisis?
So I live in a state, we are in the top 4 opioid overdoses. Rio Arriba County is Espanola. It's like an area in New Mexico. It has one of the highest opioid uses in the country. So that's very close to home, the opioid issue here in New Mexico. Naloxone is a thing that we have as a reversal agent for that, and that's carried on all medical professionals now in New Mexico because of how big this problem has gotten. As far as how we can use this or gateway drug and things like that I'm seeing, anything that you use as a substance or anything like that you overuse can be turned into an addiction. You can have too much sugar and it can turn into an addiction. You can overuse it. Regular drugs that we monitor, like the opioids, that were supposed to be monitored through physicians and then through pharmacists and then the patient, those have been abused. So there's always room for abuse. There's always things like that. But what I really love about cannabis and its benefits that it can do is there's a lot of studies that are showing that as patients start incorporating cannabis into their current regimens of pain management or whatever they're using opioids or things like that for, their opioid usage is decreasing. So they're asking for less, or they're not needing as much, or they're not coming back to their physician every time saying, I need more, it's not working. They're able to use that cannabis to kind of work with their opioids and get them to the pain management that they need. I have some family members very close to me, obviously, that have asked me advice as they've stepped into this realm of using cannabis and using opioids with a chronic disease like rheumatoid arthritis. And it's been really wonderful to help them and guide them in their therapy to get them to a point to where they were using 190 milligrams of OxyContin a day to now only needing 3 for breakthrough pain. So they're able to use and tailor their cannabis therapy to only need 3 medication or 3 opioids for breakthrough pain for, an intense chronic disease. So I think that it's got a place that it's going to be helping. I think it's going to be a huge relief in the opioid crisis if it's managed responsibly by physicians and by pharmacists and by people who can correctly give patients the right cannabis care.
Yeah, a lot of people look at cannabis as an exit drug more than a gateway drug. That it's like you were saying that you can offset the amount of opiates that you're taking by using cannabis. You can offset other conditions like alcoholism. Some people are associating with consuming some cannabis. It can really be utilized as quality medicine. And I live in a county also that has a high rate of opioid overdoses. I have Narcan in my car, in the pharmacy, just in case. It's a very big problem. And I'm sure Brian can tell you from what he's seen in Connecticut with the dispensaries that he saw a lot of opiate-dependent patients coming in, and hopefully they were reducing the amount of opioids they were taking.
Yeah, that's exactly what we saw, and what honestly gave me the biggest goosebumps out of anything we did in the dispensary, because we had patients that were coming in that, we know how the opiate epidemic works. You end up going on either, if you want to get off of them, you end up on a methadone program or a Suboxone program, which is just another crutch that they don't usually do what they're supposed to do to taper them off of those as well, nor are they easy to get off of. Well, we helped patients do, just like Shanice was saying, decrease the number of pills they're taking in a day. That to me is the most important thing, because eliminating isn't always the most appropriate thing, but getting them to a functional place is also where they're not completely apathetic and unwilling to do anything at any point throughout the day. So it's finding that right mix. I could talk about this for days. We just had a hearing here in Connecticut last week to add opiate use disorder and opiate use withdrawal to our list of conditions, and I testified for them in front of that. And one of the quotes that I gave them that I heard from a drug abuse counselor was that I think is just awesome, is that cannabis is the condom for the opiate epidemic. With HIV and AIDS, you're not going to get people to stop having sex. So what's the best way that we can, abstinence didn't work then, it's not working in the opiate epidemic, and these people need a soft cushion to fall on. And that's what it's giving them. And if you're following these patients, even going back to your previous question, one of the things that we do for our new patients, which this is just as important for our opiate patients, is have them journal everything. How do you feel when you do this, that, the other thing? How many pills did you take today? How many pills did you take tomorrow, the next day? Because they might not realize that instead of taking 6 pills today, they only took 4. Until a week later when they go back and they go through their journal and you start thinking about, well, how did my day go and how did this happen? And all of a sudden, they get 2-3 weeks in and they have twice as many pills left as they should have. And, I think when they start to realize that and they can also see what they've used to give them the best effect for their pain or to relieve that, it really just drives that, you can pinpoint that therapy so much easier, decreasing costs and everything else for them along the way. Like I said, I could talk forever about this. It's something that I love more than anything about what we do, because of how impactful this opiate epidemic has been in everybody's life. Everyone has been touched by somebody. What was the newest stat? That it was more people are dying from opiates in a year than car accidents now. So, it's unbelievable, the numbers.
Yeah.
Well, go ahead, Craig.
Oh, yeah. Like in medical states, it's known that the numbers don't lie, that states that have gone medical with cannabis, the incidence of opioid overdoses and hospital admissions have decreased. So when you just look at it in basic numbers, though, that basic number, that should say enough by itself. So,
well, this is that. First of all, we're going to end on this, because first of all, we can always continue the conversation about the opioid crisis. The one thing I know is that, and correct me if I'm wrong, but no one's ever OD'd from a marijuana or cannabis, right? Has anybody, right?
They haven't found the toxic dose even for CBD. I think the only time someone died from cannabis is when someone dropped 1,000 pounds of cannabis in someone's head. So I believe that was the only time.
Okay, well, that's external. So California voters were the first to legalize medical marijuana in 1996. It's now legal in almost half of the United States. If you live in a state where it's legal and your doctor has okayed it, you can buy it from an authorized seller known as a dispensary. And some people are allowed to legally grow their own medical marijuana. So with that said, with legalization, the more we have that, it is coming, it is happening, prohibition is ending. We are all part of that in Staten Island and Livingston, New Jersey, and Connecticut and New Mexico. We all care about people and their health and well-being, and we want to heal and we want to feel good, mind, body, and spirit. People want to use it to get relief from their symptoms, not only about getting high, and we want the best possible treatment that can be available to everybody and for it to be affordable. So all of these things are what we all collectively want to happen. And I know with the three of you and your community of pharmacologists, we have the power to live in our best bodies and feel as good as we possibly can. So I thank you all so much for being part of this this episode, and we look forward to continuing the conversation because everyone needs to. Education is vital. So if any of you have any last pieces of wisdom you want to share with everybody.
Yeah, I mean, if you're thinking about utilizing cannabis or you do use cannabis, speak to your healthcare professional. I mean, we're only here to help. I mean, that's what we want to do. That's why we got into this profession. And especially, you won't realize that, cannabis is another therapy. And a lot of people want to help, you, the patient, or they want to be able to help you get through what you're going through, and it shouldn't be something that you should be afraid to talk to anyone about, even if it's not your healthcare professional. Maybe it's your son or your daughter, or this is something you think can help you. You should really speak to them, and maybe they can get the proper healthcare professional that you would need on board. Just because this is something new and it's out of the closet, and people are utilizing it. It really can be helpful in a lot of ways, getting people off opiates, getting them to use less antidepressants, anti-anxiety medicines. There's a lot of quality benefits that cannabis can use. It can be used for. So, yeah.
I would say, just from what we've talked about in this whole segment, it's such a personalized medicine. It's individual to patient, especially from where you start to where you go to how you take it. So just that direct communication with the pharmacist or your physician is so important. And don't get frustrated with this type of medicine, because it is a trial and error. Not one time the first thing that you're going to use isn't going to cure all and do it all in the one shot. So give it some time, give that personalized medicine so that you can find the right dose and the right regimen for you and your day-to-day in your body. Give it that space to work.
I agree. I think that, one of the biggest takeaways from this is that it gives patients the ability to take back control of their own healthcare again. They can medicate when they want to, how they want to, and as necessary. Every day is different, so we should be able to medicate differently every day. If you have questions, ask your healthcare provider, though. If they don't know, find another one who does. But the thing is cannabis is not for everybody. It can be absolutely beneficial for mind, body, and soul. But there are certain situations where it might not be appropriate for you. It is another tool out there that you can use, but it is certainly not the only one. And it's important that if you do talk to a healthcare professional, so at least that way they can maybe explain to you why it's not appropriate, so you don't just decide to go do it on your own. And if they do shut you out, find one that's willing to talk to you about it. The more honest you are with your healthcare professionals about it, the safer the whole process is going to be for you.
Thank you all so much for your expertise, for your knowledge, for your input, and for your advice. We really appreciate it.
Thank you.
Thank you for having us.